Mr. Watson here, and in this video we'll be looking at joint classification. Now you might be thinking the second part of section A is joint type, but I've decided to break this into two videos to avoid information overload and to try and make things a little bit simpler. So classification of joints. Now I often see the mistake happening of when we talk about joint classification and people getting it mixed up with joint type, and this is another reason why I've separated the videos. Joint type refers to the types of synovial joints we have in the body, and the words you're going to see today, such as fibrous, cartilaginous and synovial, they are classification of joints, and it's important that we get those distinctions correct. So let's make a start. The first one in the body we have is the fibrous or fixed joints. The second is cartilaginous or slightly movable joints. So you'll already see there a characteristic of how they move. One is fixed, immovable, and the other is slightly movable. And these are commonly found in the axial skeleton. So fibrous and cartilaginous joints are commonly found in the axial skeleton. And our third joint classification is the one I've just mentioned, is the synovial joint or freely movable. And these are commonly found in the appendicular skeleton as they are responsible for movement. Okay, so there are our three classifications, and let's look at some key points about each of them and an example. So let's start with fibres, and if we focus on the cranium, you'll see we have something called sutures, okay? And these fibrous joints, such as the sutures, they're held together by fibrous connective tissue, a ligament, bone to bone, okay? So this fibrous connective tissue is what holds together these fibrous joints, and the example there is the sutures in the cranium. Now these joints allow no movement, but they are the most stable joint as you can possibly imagine, because they don't move and they're in areas where need vital things such as the brain protecting, so it's important that they are very stable. So they are our fibrous joints. Next we have cartilaginous joints, and as you can see the example there is a cartilaginous disc in between the vertebrae. So cartilaginous joints are simply joints in which the articulating bones are connected by cartilage. So here we have two vertebral bones in the vertebral column, and they are held and connected together by cartilage, okay? A fibrocartilage disc, okay? So there's your example there, the symphysis in the vertebral column. And these joints allow little movement and they are quite stable. So not as stable as fibrous joints, but they do allow a little bit of movement, or the other name which I mentioned, slightly movable, which is why they aren't the most stable, but they are still stable joints, because as we know from the previous video, the vertebral column is responsible for protecting the spinal cord. And finally we have our synovial joints. So the example on the screen there is the shoulder joint, which you might have guessed from the scapula and humerus. And synovial joints are the only joints that have a space between the articulating bones, and that means we need other features to help strengthen these joints for when we move them, and we will come on to that very shortly. So the example there, as I've mentioned, is the shoulder joint, and these joints allow the most movement, but they are the least stable joints, okay? So that increase in movement decreases our stability, okay? Hence the additional features that we will go on to mention. So just to give you a quick summary screen, which you might want to pause on, okay, we have the three classifications there, and how they are different in terms of mobility and stability. as it is quite common for exam questions to ask you to compare joints either by their classification or by joint types, which we'll look at in another video. So let's take a closer look at the synovial joint and particularly their structure, okay, because these are the joints that we're most interested in because obviously they allow movement. So this is a key focus of the syllabus, and it's important to understand the structure of these joints. So what we're going to start with is what you might call the typical features of a synovial joint, okay? So first of all, right here, we have the ligament, and how we would describe its structure is a band of strong fibrous tissue. And what its function is to strengthen and support the joint by keeping the bones together and preventing excessive or abnormal joint movements, as this would obviously lead to injuries, and it is still quite common to get ligament injuries. Next in here we have what actually makes a synovial joint is the synovial fluid, and this fluid when we describe its structure, it has the consistency of egg whites if you've ever cracked an egg, and this is contained in the joint cavity, okay, and its function is to reduce friction between the articular cartilage in the joint. And speaking of articular cartilage, this is the cartilage here, or hyaline cartilage, which we'll find on the ends of bones. It covers them. It's a spongy surface, also smooth, and it's to absorb shock and prevent friction between the ends of our bones. So for example, in the knee joint when we go running, we do not want the ends of bones rubbing together, so the articular cartilage aims to prevent that through absorbing shock and preventing friction, and that synovial fluid within the joint is trying to provide support and prevent friction between the cartilage and with the other joint features. This arrow here points to the joint capsule, and this is another fibrous tissue that has two layers, and it's lying outside the synovial membrane, which we'll come on to in a second, but on the inside of the ligament. So you have the ligament supporting and anchoring them bones together. We have the joint capsule, okay, providing structure and strengthening the joint is its function. And on that pink star there, right on the green outline, is what we call the synovial membrane, and this lines the joint and secretes the fluid inside, okay? So these are what you might call typical features of a synovial joint. And of course you'll have tendons as such, which as we know connect muscle to bones, etc. But we'll stick with them for now. But what I do want to cover is additional features. Now, as I was browsing past examination questions, I came across a question in reference to the knee joint. Now, while the syllabus says we're only to cover the typical features of the joint, they were awarding marks for additional features of the knee joint, which you might not cover if you just go off the syllabus. So I've decided to try and unpack this question as best as I can, and there is the question at the top: explain how 4 different named structures of the knee joint provide stability. Now, if you were to name the 4 from the previous slide, you would likely get the marks, but we don't want to limit or restrict ourselves, and we want to have access to all of the knowledge. So we're going to try and unpack the knee joint here, but just to note, it's very hard to get the ideal picture of a knee joint without going into deep medical science, which I wouldn't understand, and a picture that is too simplistic. So I've decided on this one. So number 1, we can actually list the patella as a feature, and its structure is a sesamoid bone And the function of this is to prevent hyperextension. So if we think about kicking a football, your knee will stop once the leg is straight, and the patella plays a part in preventing that hyperextension. Number 2. Now this is a ligament, and it's the anterior cruciate ligament. Okay, anterior meaning towards the front. So it's the front cruciate ligament, and that, as we know for ligament, is a strong band of fibrous tissue, and it's playing a role of preventing hyperextension along with the patella. It also has the function of holding the femur and tibia together, but I left that function for the posterior cruciate ligament located towards the back. And basically they both the ACL and the PCL have the same function. They prevent hyperextension and hold the femur and tibia together. And as I've just mentioned, the same structure as ligaments, a strong band of fibrous tissue. Moving on to number 4, we have another ligament, and this is the lateral collateral ligament, and again, strong band of fibrous tissue, and this is to prevent the side-to-side movements. Now, lateral meaning the ligament on the outside, and we'll cover this word lateral more when we go on to joint movements away from the midline. So on the inside of the knee, you would have a medial collateral ligament, but unfortunately you won't see it in this image, but just do know we have a lateral and a medial, and they have the same function and same structure. So they're there to prevent side-to-side movements, whereas the ACL and PCL are stopping the bones from coming apart. Number 5, I've put this one in again, but it's the articular cartilage from the last slide, a typical feature if you like. So we know it's that glassy smooth cartilage, that spongy type, and we're absorbing shock and reducing friction. 6, we have the meniscus, and this is another fibrocartilage structure, and it's there to provide stability to the knee and also aid in absorbing shock. So a lot of similar functions here. And if you remember when I spoke about the synovial joint with having a space in between, and this joint is the least stable of the classifications. It's so crucial that we have these features in order to strengthen and support when we are moving to prevent injuries. Then number 7, we have a pad of fat, and quite simply its structure is a fatty pad, and this serves as a cushion, which obviously would also help with shock, but with all of these little parts, it helps pad it out, if you like. It improves the fit of the joint, and pads of fat and meniscus are things that you might find in other joints too. And just to finish up, we have the bursae, or bursae, however you might want to pronounce it. And this is a connective tissue sac filled with lubricating liquid. So a bit like in your joint capsule, you have synovial fluid. We have this bursae, which is a sac-like structure, and it has liquid inside. And it's also there to reduce friction and improve the fit. Now, with my labelling, I've only shown you one, but if you were to look at the diagram, that dark grey, you'll see there are other bursaes in the joint. So that's just an extra slide unpacking some of the additional features, and you will find pads of fat, in the hip joint and the elbow, but it's just to give you an idea that there are other features as well as the typical ones. So, as always, pause as you go through the video on the summary slides, and go back and fast forward as you like. Thank you.